Okay, we're continuing with this book here, Prevent and Reverse Parkinson's Disease and Chronic Fatigue Syndrome. We're doing Chapter 11, Brain, Excitotoxins, EMF, and Stroke. Okay, so this is pretty advanced brain stuff, but, I think it's worth making because you're not going to hear this, anywhere else. So we're going to put together a bunch of concepts related to having a stroke and related to brain atrophy, apoptosis, and how the actual brain cells work, your neurons. Okay, so first of all, here's the anatomy of the aortic arch. The ascending thoracic aorta has all the elastic fibers, which during cardiac relaxation, diastole, they will have elastic recoil inward to generate diastolic flow. Chronic hypertension will overstretch those and you'll lose that elastic recoil, the Windkessel effect. Windkessel effect's like that German word for, it's like an accordion to blow air on the kindling in a fire to get it to start. So that's Windkessel effect. And you can remember these vessels just like your ABCs. Here's the aorta, B for brachiocephalic artery, brachial meaning the arm component, cephalic meaning the part to the head because it bifurcates. That'll be the subclavian artery there. You don't need to know all this detail, but just a general idea. So A, B, C is for the carotid, meaning left carotid artery. Starts out common carotid, bifurcates into the internal carotid going up to the brain, and the external carotid, which goes to the face. I always remember that by putting my hand like this, with your thumb being the single solitary artery, no branches on the internal carotid artery in the neck, right up to the brain. And then the external carotid is like your fingers, all the branches that go to the face. It comes up to the brain, it bifurcates into the anterior cerebral artery. This will be the A1 ACA. This will be the A2 ACA. You number them just so you know if there's an aneurysm on you can precisely describe where it is. But for our purposes, you just need to know there's an anterior cerebral artery in the middle. There's a middle cerebral artery along the side. Okay? So here is atherosclerosis in the coronary artery. This will be like the left coronary artery, left main coronary artery. It's going to bifurcate into the LAD, into the circumflex. And the yellow would be an atherosclerotic plaque there. That's your typical high-fat diet Western atherosclerosis in the coronary arteries of the heart. Also in the cervical internal carotid artery origin. Intracranial atherosclerosis is characteristically called Asian atherosclerosis, especially from isolated hypertension. A low-fat diet, but a lot of cigarette smoking and a lot of sodium ingestion. The Japanese, like in the 1960s, many of them were eating, 14 grams a day of sodium. Okay, so they had a significant amount of stroke despite not having a high-fat diet. Okay, so that's the basic anatomy. Oh, this S here of ABCs is for the subclavian artery. So you got this isolated vessel here is the subclavian artery, the left-sided one. Okay. The word cervical means neck. Okay. Oh. All right, so now we're going to look at a lateral picture of the brain. This lateral picture of the brain, so it's the anatomy of the side of the head. The naming of the gyri is pretty simple. And again, I'm giving more detail than you need because some people are going to want it. The general concept is just, this is how the brain's labeled. And the way you think of a brain is like a fist. So the thumb is like the temporal lobe. The little crease in the middle, that divides the frontal lobe from the parietal lobe, and then way in the back where the wrist joins the forearm, that is the occipital lobe. So the names are pretty simple. Superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus. All you need to do is understand English and you can understand the names of these gyri. Superior frontal gyrus from the frontal lobe, middle frontal gyrus, inferior frontal gyrus. Okay? This is a Sylvian fissure. It looks like a little snail. We're not going to get into all the details of that. Here's the central sulcus that separates the frontal lobe from the parietal lobe. Here's the precentral gyrus. Here's the postcentral gyrus. Okay, that's about all we need to know. The occipital lobe, you can think of that as being primarily for vision. The temporal lobe, you can think of it as being primarily your auditory cortex. The frontal lobe, you can think of that as the seat of personality, and of course connected to the precentral gyrus, the premotor area. So basically, you gather up information from the temporal lobe, occipital lobe, and parietal lobe. The parietal lobe is a lot for touch, position sense, and whatnot, kinesthetic sense, vibratory sense. And then that sends information to the frontal lobe. The frontal lobe's decision-making gyri are more anterior inferiorly, and then they send the message to the adjacent motor cortex. This is what you do. Okay, so that's a simplification of how the brain basically works. Oh, and then another little quote is, why do animals have brains but plants do not? The reason that animals have brains is because animals move, and plants don't have a brain because plants don't move. You don't need a brain if you don't move. Okay? As soon as you move, you have to make a value judgment. I want to get something to eat, I'm going to walk towards the fruit tree. And you have to, navigate the path, avoid obstacles. You have to be on the lookout for predators. So you need a brain. And then what's the purpose of having a brain? The purpose of having a brain is so you can walk down a path in a field, a prairie, a jungle, and survive. So your brain is to enable you to survive and to reproduce, okay? And reproducing is a lot more complicated than surviving. A lot more people are surviving than reproducing. Okay, now here is a lateral view of the brain. And it's really sort of a midline sagittal. So sagittal would be like cutting the brain like this way. This is the corpus callosum, which, by the way, is pretty much the same in men and women. Some, pop science articles used to say, oh, there's a big difference. No, there's not really. I look at them all the time. I don't see any obvious difference looking at a man or a woman. The big difference is the female's got a way bigger, premenopausal female got a big pituitary. That's a noticeable difference from across the room. There's nothing else. Okay, right above the corpus callosum, which connects side to side the brain, is a cingulate gyrus, which is a really important part of the so-called limbic. Limbic means medial edge. So the limbic system is also called the mammal brain. The brainstem, right here would be the brainstem. You can stick your knuckles up. This would be the midbrain. This would be the pons. This would be the medulla. And then the forearm would be the cervical spinal cord. That's called like your reptile brain. Reptile brain is very simple, instinctual. Lay an egg and you walk away. It's easy to be a reptile parent. Okay, this cingulate gyrus in continuity, it's called the isthmus here, connects it to the medial temporal lobe. That, like a Chicago Bears football helmet, looks like the letter C, and that is what's called the limbic system, or the mammal brain. The mammal brain, just think of your dog. It has a good social intelligence, but it's very emotional, very hyped up, lives in the present, okay? Then on top of that is the human brain. Okay, you can call it the primate brain, but we're so much more sophisticated than a chimp, it's not even funny. I consider that an insult to be associated with a chimp. There's a lot of people who think we should be in a completely different category than chimps. I would agree with that. Our brain's 3 times as big, and a dog is smarter than a chimp. Okay, so anyways, this is our cerebral cortex, and the more you get towards the anterior, inferior areas, the more you have so-called executive function, personality, making value judgments, being able to have self-control, delayed gratification, ability to plan for the future, ability to integrate complex information and detect the nuance. Okay, so that's what makes us most human. All right, and the other gist of it is the mammal brain, right here, cingulate gyrus going into the medial temporal lobe. That's very impulsive. That will do a lot of things that are not the wisest as far as long-term judgment and consequences. Whereas the cerebral cortex allows you to think in an open-ended way, to contemplate the effect on the future of what you're going to do. So basically, you go into mammal brain whenever you're stressed out. Fight or flight, run, climb a tree, do what you got to do to survive. All right, but you want to, most of the time, be in more of a cerebral cortex brain, a thoughtful, intelligent, aware brain that you'll interact better with people. So when you're in a mammal brain, stressed out and pissed off, you might say something rude to your boyfriend, girlfriend, wife, husband, and you'll regret it later because you say something nasty. So you don't want to do that, okay? So you have to say to yourself sometimes, I'm feeling kind of impulsive. I need to chill out. Let me slow things down here. I'll give an answer tomorrow or the next day. Or let me think about that before I answer, rather than say the thing you want to say, even though it's pretty rude. Okay. So a mammal's got a more sophisticated brain too, because in a sense, a dog has live-born young. It's a mammal and has to nurse them. Okay. So, and dogs are social too, so they've got a lot more social intelligence than most animals. But then the humans with their cerebral cortex are much more sophisticated in being able to cooperate long term. That, by the way, is called the triune brain of Maclean. Maclean was a Harvard neuroanatomist, the 3-part brain. So brainstem, reptile brain. Limbic lobe, meaning cingulate gyrus in continuity with medial temporal lobe. Mammal brain, like a Chicago Bears letter C on their helmet. And then cerebral cortex, the human brain. Okay. Now I'm going to show you an axial image. An axial image means to cut through the brain transversely. Okay. You're like cutting through your vertebral column like a slice of bread. That's an axial image. And we use that term in neuroimaging, like when I'm describing films to one of my buddies or a neurologist, neurosurgeon or something, I'll say, axial image through the basal ganglia, there's a lesion, let's say, in the left thalamus. You always imagine that the patient's feet are towards you. So that's how you know right from left. So if the feet are towards us, this would be like you're walking into the room, the patient's on the CAT scan table or the brain MRI table, and their feet are towards you. So this would be the right side, this would be the left side. Okay. And this is a standard basal ganglia anatomy picture. You know, anybody that works with the brain will have to memorize this. And so the simple anatomy is this is the cerebral ventricles with cerebral spinal fluid, third ventricle right here, foramen of Monroe, right frontal horn, right occipital horn. Okay, here's the basal ganglia. The lentiform nucleus with the putamen on the outside, globus pallidus on the inside. Here's the caudate nucleus. And here's the internal capsule. It looks like a boomerang, okay? And then you can remember head, arm, and leg is the position where the significance of strokes. So you have a lacunar infarct up here. It'll affect the head, the arms, the legs. Okay, I remember the globus pallidus is pals with the internal capsule. Putamen's on the outside, so you say to put a man out. He pissed off his wife, he's sleeping in the doghouse, okay, to put a man out. And here's the thalamus, okay. So that's basic basal ganglia anatomy. The relevance being that there's a lot of diseases related to these basal ganglia. The basal ganglia means where the cell bodies are, the nuclei, okay, versus all this other stuff out here where there's nothing drawn there. That's the white matter, just the axons of the neurons, okay. And this is the gray matter ribbon is the cerebral cortex. Cortex means bark, like the bark of a tree. So an axial section is like a tree stump. And you have the gray matter ribbon around the periphery, the cerebral cortex. That's what the cerebral cortex is. The periphery, gray matter ribbon, where the cell bodies are located. All the rest of the stuff is white matter. The axons pass through it as they travel to other destinations, like travel to the basal ganglia and then down into the spinal cord, for example. Okay, and the relevance, the reason why this area gets talked about a lot is there's diseases related to these different gray matter nuclei, as well as is a very common location for strokes, most commonly a hypertension-related stroke called a lacunar infarction. Okay, the insula is like this little island of cortex that's indented into the brain right next to the putamen. Okay. And then this is sort of the external capsule is the white matter outside of the putamen. There's a little thing in there called a claustrum, which we don't have room to show in this picture here. Okay. Okay, now I'm showing you the coronal section. So coronal section will be cutting from front to back. You could also call it like a frontal view, frontal projection. So again, right foot is towards you over here, left foot here, so this is right brain, left brain. Okay, and this is the hippocampus. That's the main memory center for declarative memory, so you can say things, you know. I was at a party on Saturday. That is a declarative statement, okay. And the hippocampus, you know, the old joke is it's the, what neuroscience center has the fattest students? The hippocampus, okay. It's the key memory center, and it's located right here in the medial temporal lobe. This actually is in continuity, the medial temporal lobe going up into the cingulate gyrus above here. So this would be the corpus callosum. This is the cingulate gyrus up here. Okay. Looking at these lobes, another thing you could think of is if you had your eyes closed and you're sitting on a functional MRI table and they ask you, so what you thinking about? Most people would say, I'm thinking about relationships, and that's largely through the cingulate gyrus right there, because our social relationships are important to our lives, so our default setting is to think about them, okay? Then the insula region here in the insular area is largely associated with change. So it's part of your staying alert. So basically your eyeballs have rods in the periphery, and if they sense motion, they're like motion detectors. You turn your head to look with both eyes, and you will see it. And then you catch the motion, you turn your head, so you get binocular vision, stereoscopic vision. You have increased resolution. There's more concentration of the cones close together in your fovea, you know, your focal spot. And you have color vision, and you can see more precisely. You can identify whatever it is coming towards you. Is it a predator? You got to defend yourself, okay? That's how your eyeballs work, and that's why you also can't have like a TV set on over here and try to concentrate on something over here, because you're just going to keep on paying attention to the motion. We're just designed to do that, okay? And that'll pull you out of your contemplative default mode network. And on the outer surface of the brain is largely where you have your task-based network, which means to get you to do stuff, okay? To pay attention to some detail. In general, you can think of left brain as being L for language, L for logic. And that's like the type of brain you're going to use at school, you're going to use at work, okay? The right brain is more your so-called artistic brain. It's your more subtle brain. You're more for metaphors, for jokes, for nuance, for singing, okay, for religion, things like that. It actually gives you a more holistic view of the world. Whereas the left brain, you're paying attention to some detailed thing. That Ian McGilchrist, psychiatrist guy who wrote The Emissary and Its Servant book about the right and left brain, he's got a whole bunch of YouTube videos. His RSA animated video is pretty good about the right brain versus the left brain, but that's the gist of it, okay? And in a sense, too, you can think of the left brain as being like the predator brain. It gauges everything, has complete information, deductive logic. There is the prey, I shall approach like this, okay? Versus the right brain is more of a intuitive, like a prey. It's looking around, it's inductive logic. It doesn't have complete information. It has to survey the situation. I heard a noise, what is that? Oh, it's just my friend approaching. Oh, there's a noise over there. What is that? That's a hawk, that's a snake, that's a coyote. I got to pay attention to that. So that's kind of what the two sides of the brain do. And one of the things that's nice about the brain is the brain is the brain. It's been around for a long time, and its job is to make you survive and help you to reproduce. Okay? So the brain is real, and there's nothing fake about it. It doesn't change its pronouns every 6 months. It is real. Okay? So that's one of the reasons why it's kind of cool to study the brain. Okay, we're going to do a little more neuroanatomy here, and then in the next lecture we'll get into more of the diseases and stuff. Okay, inside the brain parenchyma itself, the brain tissue itself, the brain substance, parenchyma and substance and tissue are all kind of the same thing. There's no lymphatics. But in the meninges, the outer coverings, there are some lymphatics for the brain. When you are asleep, the brain cleans itself. So your individual neurons pump out their waste products. It's like the English Victorian age dumping out their chamber pots at night into the street. And then if you're lucky, it rains and the water rinses it away. So what happens in the daytime, you have to be active. You have to pay attention. You have to be alert. So your brain cells cannot go offline. They have to have a precise perineuronal milieu, ionic concentration, so the neurons will function effectively with their action potentials when they communicate with each other. But at night, when you're asleep, your brain cells can go offline, and that's the good time for cleanup, to pump out the waste products. The spaces around the neurons are called the perivascular spaces of Virchow-Robin, and they'll allow more CSF fluid to flow through there to rinse out the neuronal waste products and clean the brain. And that's why when you wake up in the morning, your brain cells are all clean, their waste products have been pumped out, you're fresh, you're smart, you're ready to go. You get just a little bit of a burst of cortisol, which you want, maintains your blood glucose level, perks up your alertness, because you think about it, when does an animal need to be smart? It needs to be smart when it's hungry. It's hungry when it wakes up in the morning, typically in the sense that it has to go find some food, break fast, to break your fast. You fasted overnight. Now, don't get me wrong. I know that most of us aren't that hungry when we first wake up. That's because we get that cortisol surge of glucose to give us the energy to go look for food, okay? I personally like to do my academic work in the morning because I know that's when I'm smartest, okay? But from an evolutionary point of view, the animal was given the energy to go out and find some food, and its blood glucose was maintained with that little cortisol surge in the morning. But yeah, that's definitely the best time to do whatever academic work you do. Okay, so that's the gist of the glymphatic system that runs at night. That was only figured out like in the last 15 years. But that's a key thing. The more the day goes by, you get a little more tired and sleepy and a little bit dopey. Okay, now we're going to look a little bit at the arterial anatomy of the brain. So basically the way I work my days, I'll do my most challenging academic work first thing in the morning. When I start slowing down a notch, then I'll do my next level of challenging work. This is not my day off if I'm at home. In the afternoon's a good time to exercise. So I'll go work out, whatever that might be, lifting weights, reading on a treadmill, things like that. And then the next thing is, in the evening, that's a good time to, eat dinner, called the old man diet, 1 meal a day diet, and I like to read while I'm eating, or I'll watch a YouTube video or something like that. Okay, here's the blood flow to the brain. Earlier we showed the picture of the carotid arteries going up to the brain. So this would be the left side. Remember, the patient's feet are towards you. Left internal carotid artery. It would have an anterior cerebral artery branch, which I didn't draw in here because it's too complicated. But here's the middle cerebral artery branch. The first branch is the M1 MCA. The little branches that come up from it are the lenticulostriate arteries. They're going into the basal ganglia here. This is a coronal projection, like you're slicing the brain from front to back. And these lenticulostriates go up into the brain parenchyma. Here's the frontal horn of the lateral ventricle, contains cerebrospinal fluid. This is like the M2 branches, and they're going to end up going up over the convexity, okay? And there's going to be a little dip. You're going to be talking about M3, M4 branches and all that. But the whole point is I just call them convexity branches of the middle cerebral artery. And they're going to go up to the top of the brain, and they're going to drop these little perforating arteries or penetrating arteries that go into the brain parenchyma. The reason for drawing the skull and crossbones here is because that's the most common spot people get little strokes. Okay, this is called association cortex, where it's just association, deep white matter. Okay, this is just white matter axons. At the level of the frontal horns, it's called the corona radiata. Below that level is where you have the third ventricle and you have all the deep nuclei, the basal ganglia. So that's basal ganglia level. If you were cutting through this on axial images, here's the corona radiata at the level of the frontal horns and the body of the lateral ventricle. Above the ventricles, you are in what is called the centrum semiovale. Centrum because it's in the center of the brain. Semioval because it has a semi-oval shape. And the relevance of those terms are, we use those all day long every day to describe strokes. Basal ganglia stroke, corona radiata stroke, centrum semiovale. Usually we just call them in the centrum semiovale. Centrum semiovale, flare hyperintensities. Flare is the name of the sequence. Brightness is just like a T2 hyperintensity, meaning destroyed brain tissue. Okay? And almost always it's due to chronic small vessel atherosclerotic ischemic disease. Okay? It can be a few other things, but that's what it usually is. Okay, the reason for the skull and crossbones is that there's not very good collateral blood flow to where the skull and crossbones are here. So if you drop perfusion pressure to this spot, stroke. And the same patient can have 100 little strokes. They're just little tiny things like the size of your pinky fingernail is what you see in that area. And I see over 1,000 of them every day, okay? And it's just like, imagine you had an airplane just popping rivets off it. Pop all these rivets off it. The plane will still fly for a long time, but eventually that plane's not going to fly too well, okay? And that's your typical person, fat, sick, and stupid in their 60s, okay? They might have just lost a step in their 50s cognitively, but they can't keep getting all these little white matter strokes, and eventually they're screwed. They're just stupid. Okay. All right, next is we're going to talk about capillaries. I think I'm going to stop right here because we covered a lot of information. That's an introduction to the brain. I'll review some of it more as we go along, but we kind of got to build up some anatomic knowledge before we can get into how the diseases occur, the pathophysiology. So that's the end of part 1. Hope you found it helpful.